Hello everyone, this is Dr. Cui. So in this video, I'd like to talk about another commonly asked questions, what motivates you? So in order to answer this question, we need to know that this question actually is pretty similar to why you want to become a doctor, why internal medicine and why other subspecialties. So you can always apply those answers of those for those questions to this one. And as I always mention, just change a little bit. And but be careful here. You need to let the interviewer know the reasons behind that. You need to have a good reason for that motivation, and also your example should be related to your background, and which is more convincing. So, for example, if you tell the interviewer that you want to become a cardiologist, but you have your subspecial training in your home country is kind of like a nephrology or other or ophthalmology. So actually, that's not a convincing. So you have to uh, use the example related to your background, and you cannot just say that I want to be a cardiologist without any uh, experience of that, or at least you should see that you have some you did something when you were med school, or you did some rotation after graduation in cardiology department or something like that, in order to convince people you have you indeed you have some background or experience on that. So just be careful. Okay, so here I will give you my example. So, okay, Dr. Cui, can you tell me why or what motivates you to become a cardiologist or the physician? Actually, that's a good question. I would say that I want to, as I mentioned that when I was in the med school, I had a chance to see how a doctor saved a patient with a acute myocardial infarction within just 15 minutes, and I was so impressed during that time. So from that time, I made a decision that I definitely want to become a cardiologist. So that's why I went to the institution in the United States and joined their PhD program and studying the cardiovascular diseases. And also that's why I went back to my home country and completed internal medicine residency training. And and after all of this experience, I had a chance to join the American Heart Association conference. And in the conference, I saw those world-class professors, clinicians shared their fabulous clinical experience, knowledge during this conference, and I was so impressed. So from that moment, I further made another decision that I definitely want to become a cardiologist in the US. So that's why I came back to the US again in 2017. And also that's why I'm still working on this area. And my research is also related to the cardiology. You see that one of the project I'm very proud of is air pollution and cardiovascular diseases, and which is awarded by the which is supported by the NHR1 grant, and that's and I would say that put them together, all of these reasons, the things that drives me to pursue this subspecialty. So, and also the last reason I would say that because because of my family, one of my family members is also cardiologist, and he always taught me, and I was definitely influenced by him as well. So I would say that all of the reasons drive me to become a cardiologist. So you can see that in this in my answer, I just tell them I told the interviewer step by step why I want to become a cardiologist, and what motivates me uh, to this step, and what I did for realize my dream. So just step by step telling him, and all with my background, my experience, like both of my clinical and research experience. So and also I mentioned the last reason because one of my family member who is also cardiologist. So put them together, all of the reasons drive me and motivate me to become a cardiologist. So I hope you will get something from my answer, and good luck.